Hey fam, welcome back to Muse and Be Well. We are so glad to have you. For anyone new here, I am Taylor Chanel, a visual creative and certified sound healer.
I am Misha Battiste, a certified life and leadership coach, and this is your space for learning to live well, aligning purpose and well-being.
I know that's right. So, I'm so excited for today because we have a very special guest with us today to talk about something that I think is quietly affecting many of us. And I think a lot of us have been taught to just push through it. And that it is pain. The aches that showed up one day and just stayed, sadly.
When you hit the 30s, the back and the knees start hurting. We're talking about that today and more. But yeah.
All that. But just like Misha said, the neck that's stiff, that has been stiff for months, the knees that protest every time that you go up the stairs. Listen, that happened to me today at Melat House. The back that keeps talking to you since you transition into your 30s, watching your parents slow down and not knowing how to help them.
Yeah, and what makes this conversation so special today is that we actually have an incredible doctor who works in the pain management space. And I don't even know if I'm using the right terminology there, but she's going to teach us the right terminology to use very shortly. And we're going to ask her all the things that we have been wondering about, and hopefully you guys have been wondering about too, such as understanding our own bodies better. How do we advocate for the people that we love, like our parents or grandparents who are aging? And what does healing actually look like? What does healing the pain look like when you don't want to take the medication? So I am so excited to. Oh, you're going to introduce her. I'm going to calm down.
Yes.
Go ahead.
Okay, perfect. Okay, so now I get to do something so special and introduce my best friend, my sister, my college roommate for all 4 years. She hates when I introduce her as that. One of my angels here on this earth, my role model, my soulmate. We've shared a bathroom, we share tears, we share late nights, some other type of nights too, but we won't get into that. We share dreams. Girl, listen, that's a story for another day. We could have a whole podcast about that, okay? But anyways, I'm not going to spread her business out there like that. Okay, I'm sorry. Now I'm unhinged. Okay, let me take a moment.
Love it. I feel like I'm going to be the adult in the room today, and that's a change. So have fun, Taylor. Have fun, girl.
Yeah, girl. But okay, I've had the absolute privilege of watching this lovely woman that is here today. Her journey up close from our dorm room at Howard to where she stands today has been a sight to see. And I am so proud of her. So for those of you who don't know, let me introduce you to her. Okay. Doctor. Okay. Put some respect on her name. Melat Gebre didn't just graduate from Howard University. She graduated summa cum laude. Can I get an amen? Holla, holla.
I'm dead. This about to
She
be a
then went on
7-minute
to earn her
intro.
medal. Would you say?
It's about to be a 7-minute intro.
Yeah.
Like a
She
pep
then
rally.
went
I
on to
love
earn
it.
her medical degree from Emory School of Medicine, where she also completed her anesthesiology residency. And while she was there, she was awarded the Amit Zygon Award, given to doctors who go above and beyond for their patients and their peers. And she was selected as a resident scholar through the Foundation for Anesthesia Education and Research. I know that's right. She went on to publish over 10 manuscripts, present 12 research presentations at national and regional conferences, authored a book chapter, okay? And then, because she wasn't done, and in true Melat fashion, overachiever, she went to UC San Diego for her Interventional Pain Fellowship, one of the most prestigious programs in the country, where she trained in cutting-edge therapies and built expertise in both outpatient and inpatient pain management. Come on now. And then after that, she took her skills to a private practice in the DMV, treating a wide range of complex pain conditions. And then she came back to where she calls home now, the lovely Atlanta, back to Emory, where she is now an assistant professor in the Department of Anesthesiology, and her interventional pain practice is based at Grady Memorial Hospital, where her specific mission is making sure that patients who have never had access to advanced pain procedures finally get them. Beyond every degree, every publication, and every award, she is someone who looks at every single patient and sees them as a whole being, not a chart, not a diagnosis, but a person, and she treats them exactly as that, a human being. So, fam, please help me in welcoming my sister, Dr. Melat Gebre.
Thank you, thank you. Thank you guys for having me, and thanks for that intro, although semi uncomfortable for me to do that. But I appreciate it, and I'm super excited to be here with you guys.
I'm so
Look,
excited.
audience, you see, we gonna bring y'all to professionals. We gonna bring y'all to people who know things, okay? Like, the resume, how old are you, girl? Like, this is like a 45-year-old resume right here. Like, come on now. This is amazing.
Yeah, I got gray hairs to attest to it, but yeah,
Girl,
here
she's
we are.
34, if you wanted to know the answer.
Well, putting
Same.
my age out there?
Girl, we went to college together, they know.
Yeah, that's true.
Well, we are about to do our Muse Moment. You know, as we always like to say, we're nosy. So Dr. Melat is going to join us in this, our Muse Moment. So I can't wait to hear what she's going to say. But I'm going to kick it off. I don't know if I shared this before, but I've been reading Alice Walker's book, In Search of My Mother's Garden.
Mm,
And at the start of the book, she talks about the need for models. If you're like an artist or just a person, right? Like to have a model who is offering you, who is showing you possibilities and like what is possible out in the world, like a role model, for example. And she was talking about how Toni Morrison, she appreciates the quote of Toni Morrison saying, I write books that I want to read because the books that she wants to read don't exist. So she has to create them.
mm,
And essentially, what Alice Walker is trying to say is that Black people, Black women, we don't have a lot of models to shape our dreams around, our visions around. So we do have to be the ones to sometimes create that. And so I kind of plugged that theory and framework into the last week's Met Gala, which will be 2 weeks when this actually airs. And there's two women in mind that I feel like really represented this idea of being your own model. First
mm,
one was the Angela Bassett, who did the thing. She wore this Prabal Gunrong dress. I don't know how to pronounce the designer, but I'm gonna do it again. Prabal Gurung. I don't know. But she wore a dress that was designed by him, but was inspired by this Harlem Renaissance painting, Girl in the Pink Dress by Laura Wheeler Waring, which was done almost 100 years ago. This painting was done in 1927. So Angela reimagined the dress and added some details. And what the idea was is to honor the process of aging, like just maturing and wearing this pretty in pink dress, which is usually when you think about hot pink or pretty in pink, you think of like a 16-year-old. She's
mhm,
a 60-year-old and she's just trying to represent and like remind older women that you can wear pink, you can be beautiful, you can find youthfulness in yourself. So I feel like that was an example of her representing for herself that while she is aging, she is still youthful and beautiful and she can wear pink. So that's one option. And then the other one is Amy Sherald, who is a Black artist her dress was designed by Tom Brown, but it was inspired by her own painting, Miss Everything, Unsuppressed Deliverance. I thought that was so cool. Like literally the dress and the person in the painting, she created it herself. Literally, she created this
mhm,
picture and then put it like that is literally the definition of being a muse to yourself. And I think it
mhm.
was so cool that she was able to do that. And there aren't a lot of artists today who are attending the Met Gala who get to do something like that. So yeah, I feel like both of those looks were representing the model that they created for themselves and for others. So we get to experience that and see that. Those two are my
Yeah,
muse moments.
I love that. The artist wears her art.
Yeah. And the theme for Met Gala, if for folks who didn't know, is fashion is art. So that's why they take these paintings and these ideas and put them on themselves.
And I
I
love
love that.
input facets like pink, because like I feel like in Hollywood aging is so, I mean, people are getting facelifts and all sorts they just everybody wants to stay young, I guess, and youthful, but especially in Hollywood. So that's cool that she kind of took something that is people wouldn't think is like age appropriate and made it kind, so that I like that.
Yeah. Age appropriate is the right word. Yeah. She reclaimed pink.
Yeah, I love it.
What about you, Tay?
So my muse moment, speaking of pink with this pink cover, is Miss Kiki Palmer, girl.
Hey.
Yeah. So as we know her as a lovely multi-hyphenate entertainer, I love her podcast, Baby This is Kiki Palmer. But to be honest, I've been kind of struggling on this multi-hyphenate journey. And so I was like, you know what? Let me tap into someone that I think does it well and is of my age, right? That seems like a little bit more relatable to me right now, specifically in this moment. So I bought her book titled Master of Me. And I'm still going through it. I'm still reading through it. But the other day I was reading this chapter. It's called America, We Have a Problem. And I'm going to summarize some things that I took away from that.
Hop off.
So she notes that we need to stop trying to beat the system and start mastering yourself because systems change. But when you know who you are and what you bring to the table, you stay adaptable and upheaval starts to look like opportunity. And then she touches on investing in yourself and she uses Aziz Ansari. I think I'm saying his last name correct. Hopefully, I'm not butchering it.
You are.
She uses him as an example of the fact that he doesn't have to fight for his roles. He doesn't want to because he has his stand up. So he can get on a stage, say whatever he wants, right? Make a check, and then pour that back into his own creative outlets, which is personal power that she references, and knowing your value and using it as a door and not a ceiling. And then she talks about this idea of diversifying your life portfolio and knowing what your value is, knowing what your personal power is, and leveraging those things so that you can get what you want, or so you can decide to not do something that you don't want to do, right? And then diving a little bit deeper on that, she mentions spreading yourself into many spaces. So this speaks to like the multi-hyphenate part, which is something that I can relate to, and letting go of, I thought this was interesting, letting go of the college major mentality that you only have to pick one thing and go all in that one path. And she encourages you to pick up several things, commit to them at a sustainable level.
Oof.
Right. And then let them grow in parallel. And what you learn from one, you can then take into the other, and that creates the value that only you can have. So a good, like, unique combination that only you can bring to the table. And then she talks about having to be honest with ourselves about how far we're willing to go and where you're willing to draw the line. Because every choice you make informs like the career that you'll have. So she said for her, like non-negotiable is that she would rather file for bankruptcy than compromise her integrity or do something that makes her feel bad about herself, which I thought was interesting. And then she talks about a big part of mastering yourself is not being so delulu and thinking that you're going to just make this big thing or have this big offer come to you if you just hold on tight. So she says, sometimes when we hold on tight, we hide behind that, and that essentially we don't open up the space to manifest and actually collaborate with other people on our journey. And then she also talks about how every day should be a negotiation with yourself. Closing out, she talks about, well, she says this quote and says, I know that we can outsmart the system, but we also have to start outsmart in the system. So working harder, not working less, but the payoff is freedom to say no. And it solely shouldn't just be about the money. It should also be about looking at experiences and your proximity to being associated with, let's say, a set project or an individual or a company or whatever it may be. So for me, the lesson here was mastering yourself first, and then you can set the terms for your life and what you want to do.
Okay, Miss Kiki. Okay.
Yeah, girl.
She
So
got
that's my muse moment.
She got some wisdom there. I mean, there was a couple of like a lot of gems that you just dropped that
Mm-hmm.
I have thoughts on all, but I'll hold them. Did you have anything you want to share about that, Melat?
No, I mean, I love Kiki. I feel like she has so much depth, and wisdom. Like, I feel like she's 30 something, but she's internally like 70. She has, no, I'm serious. I just feel
No,
like
yeah, you're not.
she's like lived several lives or something. So whenever I've heard her speak, I'm just like, wow. So, I mean, a lot of what you had said, yeah, so many points. One thing at the very end that you said about it just kind of reminded me, sort of related, I guess. But one thing Aditya, my husband, always tells me is like the biggest leverage you can have is your ability to walk away.
Mm-hmm.
So
Yeah.
whenever you are negotiating or whatever it is, whether it's buying a house, whether it's negotiating a job, whether it's whatever, if you have the ability to walk away, that's the biggest leverage you have. And then it changes your negotiating power. So it kind of reminded me of that little thing that he said. That's definitely held true a lot in my life. It's like if when I was looking for jobs when I moved back to Atlanta, it's the ability to say no. I this is what I want and this is what I think will work for me. And then if they couldn't meet me where I was like, okay, well, thanks for the opportunity. And that's the biggest leverage you can have.
That's so
Mm-hmm.
real. Like knowing your values. Also, like, so knowing what your value is, but also knowing your
Mm-hmm.
values is important. And then I also, like, what I was picking up on is like knowing your zone of genius too, like knowing what you're good
Mm-hmm.
at, being able to articulate that and really kind of like, well, obviously refine it, but like be able to define it for yourself, like what your genius is. Cause I think that is, as we look towards the future, and I don't think the future of work is going to be what it currently is. It's going to be portfolio work. So right now is a great time for folks to really drill down on what they're good at and what they enjoy doing and what that can look like as a business model. So,
Absolutely. I also think that ties into I'm gonna plug you right quick, Misha. But like knowing your strengths, right? I think we briefly touched on it in a previous episode. But like now is the time to figure out like what are you naturally good at? Um,
yeah.
so that you can use that as a leverage and as a tool for you to propel forward too. So just
Yeah, and just to thank you for adding that. So I am certified as a Clifton Strengths coach, and so the assessment that folks take, it basically asks you questions to help you figure out what is already making you successful and how do you elevate and drill down on that and not worry about what you're not good at. So if folks are interested in doing that type of assessment, reach out to me. We can talk about it. So thank
yeah,
you.
girl.
Yeah, girl.
No problem.
Okay,
Okay, lot
here, yeah, go ahead. I want to
over
hear.
here saying your nickname. I'm sorry.
My
Okay,
my
Maylot.
Yes, my Muse moment is not that deep. So my Muse moment, well, no, I at first, then I rethought it, and then it became like more deep, and then I was like, nah, I'm just gonna go with my original. Which
Yeah.
is, I mean, my Muse moment, my Muse moments in my life are just turning my brain off for a little bit. Like life is so hectic with work. I have an 18-month-old and things like that. So my favorite time, or one of my favorite times, like when I'm alone, is in the shower watching Real Housewives because I don't get to watch TV anywhere else. So I have like a little nook for my phone and I watch so much Real Housewives. I watch episodes sometimes, almost. I get like pruny in the shower. It's crazy.
Real life true.
It is real life true. Like I could probably have a
Yeah.
meeting in my shower. I spend so much time in there, but probably because I'm like semi hiding in there. But
Motherhood, I understand.
and
No.
yeah, no, I love it. I love it, which is so interesting though, because like I don't relate to those women on so many levels. I'm not materialistic. I'm not really catty, but I don't know why. I love them. I love watching them, and my husband judges me all the time, but I can't stop.
I'm sure he likes it secretly. They all do. Because we all like, it's the mess. It's like not our mess. It's
Yes,
their mess. So we can enjoy it truly is escapism.
it
I'm
is.
actually fasting from Bravo this week because
Wow.
it's taking up so much and I need my brain back.
God,
That's
I understand
crazy.
that, though. I understand that. If I got out of the shower, I could probably answer a few more emails. But no, I'm in there watching. Like,
But when I'm back, I'm going to steal your idea. I will be watching episodes because I don't, anyways. I want to ask, do you watch Married to Medicine? Since it's Atlanta, you're a
I
doctor.
do. I do. Yeah, I do. Oh man. Funny story about Married to Medicine. I was at we were at Lenox. It was me, my husband, and my daughter, and I saw Damon which is Heavenly's
Oh my God.
And I
Dad,
told my
saw
husband,
Dad?
yeah, I was like, "Hey, I think he's from TV." And then he was like, "What TV are you talking about?" And I was like, "Married to Medicine." He's like, "I don't know what that is." And I was like, "Let me show you." And I show him and I was like, "That's him." And then I was like, he was shopping for sneakers. Me and Ayana were just messing around. And I was like, so I started getting closer because I was like, "Is it him?" So I'm looking and I'm trying to make eye contact. I'm like, maybe it's him, maybe it's not. And then he looks over and smiles, and I'm like, "Hey." And I was like, "Are you Damon?" And he was like, "Yeah, do I know you? Are you a doctor?" And I was like, "Yeah, actually, but like, I don't think you know me."
Girl,
But
you gonna get casted. You gonna get casted one day.
and my
When
husband,
Dr. Jackie retires, you can take Dr. Jackie's role.
I could probably not do that show for many
Yeah.
reasons, but I do enjoy the show. But I was talking to him, and he was like, where'd you go to school and stuff? And I was telling him, I did residency in medical school at Emory, and he did some of his training there. And he's like, "Do I know you from there? Like, what year did you graduate?" And I told him, and he's like, "Oh no, I was way gone." And I was like, "Yeah, I don't think you know me, but this was a great conversation." And then we exchanged numbers.
You will be getting a cast tape. You're gonna be getting an offer soon, darling. He was trying to cast you.
Yo,
Right. My parents would be so disappointed, but I would love being in the confessional and being messy. Oh my God, I would love that.
she would thrive on national television. I kid you not.
Look.
She would thrive.
I love that this is happening. We're gonna get you on a reality TV. You got a nice house. I'm sure you got the husband. He probably has a good job. Like this is
Her
made.
husband's also a doctor.
Oh, girl. Okay. Did you had there's something that's been on your mind that I wanted to make sure that I heard.
Yeah, on a more legit level. Yeah, so I've been thinking about it's actually interesting. I mean, you guys are much more of an expert on this than I am, but the impact of AI is crazy. And I've been reading a lot about I deleted Instagram and Facebook. I don't have TikTok. So I've been actually when I'm on my phone, I've been reading articles, medicine related articles, and the impact of AI on medicine. I mean, I already use it to help me type my notes, which has been helpful. But
Yeah.
I am starting to think about how it may replace certain types of doctors or reduce the number of doctors you need to accomplish certain things. And I don't know. I just think I enjoy AI. I use it, like I said, to do my notes and then day to day life. When we travel, Gemini does a pretty good job too, if you want to put in the work. And I've used it for that. But sometimes I think about how, I don't know, as a whole society, with all this power, we have not gotten more intelligent. We have not gotten closer. I was talking to my father-in-law yesterday, and he was telling me how in you know, 30 years ago, he would have to write letters, he would have to travel, he couldn't even call, and what he had to do to make an effort when he was seeing my husband's mom, my mother-in-law, and dating and meeting her family and things like that. And we were just talking about how everything was more intentional. And I feel like now I was telling him, we're way more connected, but we're way more distant. And with AI, I just think I don't know. I don't know if it's for overall for the better. I don't know. I think there's a lot of things it could optimize, but is optimizing everything the answer? I don't know.
Yeah. I mean, and honestly, the idea is that AI is supposed to save you time, but working with it and trying to get it to where you want it to be is a time waster. But I'm really interested in what you were saying about how what the impact will be for doctors, because I know that a while ago they were saying that lawyers, doctors, and another maybe engineers, something they're gonna need less of them because of AI, which I think most of us are gonna be BS. That's I wouldn't trust that. But you're thinking that. I want to know what's your perspective there.
Yeah, I think I'm I mean, there's certain jobs, there's certain types of doctors like radiologists, they review images. So if you get a chest x-ray, they review the x-ray and they comment on findings. I mean, AI
No.
can review an image to faster but AI is not perfect.
Yeah.
And neither is a human, but so there are definitely certain types of physicians that their specialty lends itself better maybe to the assistance of AI. So I think it's just going to be the balance of what I think is going to happen is it's going to optimize things, which it already has been. Like, for example, notes. I don't want to be typing while you're talking to me during a patient visit. And that's oftentimes what you have to do before we had this kind of assistance is like, I have to make some notes because I may have to see the next patient right away before I finish this note. And the further away I get from your note, it may not be as accurate
Fresh.
recall or things like that. So mundane tasks like note writing, I definitely think AI makes sense.
Yeah.
But other things, it's just there's other things that I think we have to be very careful to protect. And then also the human interaction, like your interaction with a physician, with your physician, who probably, like, I would hope, cares about you. You don't go into, most people at least, don't go into medicine just for the money. So if you're really there to help people, that connection is so important. And you can never get that from AI. So I think that it's going to continue to optimize things. And I hope what it does is it gives the physician more time to spend with the patient and listening and that
Yeah.
human connection. And it takes away the silly tasks like billing and writing your note and things that you could use your time better elsewhere, essentially. Yeah.
I hope
Yeah.
hospitals are listening to you. But this is a perfect segue into the meat and, well, almost into the meat and potatoes because now we're heading into our grounding moment.
Melat, thank you for sharing. All right. So before we get into the meat and potatoes, if you have your essential oils handy, you already know what time it is.
Can I smell
Melat,
a
if you want to grab
candle?
a candle or something.
Yeah, I was going to say.
Yeah, you can grab a candle. I know you got one right behind you.
I'm just going to smell this plant.
Okay.
Perfect.
You can do that.
What kind of plant is it?
I don't know. My daughter gave it to me for Mother's Day.
Perfect. Yes.
It'll be my
Perfect.
grounding moment.
Yes, that's beautiful.
If you have your essential oils, place a drop in your hand and rub them together. Make a tent with your fingers over your nose, and we're going to do a big inhale and exhale. That feels so good. Inhale and exhale. Inhale one more time and exhale slowly. Wherever you are, if you're driving, please keep your eyes open. But if you're at your desk, folding laundry, doing some things around the kitchen, this is your invitation just to take a brief pause. And we are going to soften our shoulders. You can roll them up if you need to. Let the tension and the stress out a little bit. Unclench your jaw. Maybe move from side to side. Do some neck rolls. Saw me a lot doing that earlier. All right, y'all. So we are going to practice a new breath work technique that we are bringing to the table today, which is resonance breathing. So we're going to inhale for 5 and then exhale for 5, even and slow, like a wave that's coming in and moving out. Y'all ready?
Yes.
Yes. I just need to get
Let's
back.
begin. Yeah, girl. Let's begin. Inhale. 1, 2, 3, 4, 5. And exhale. 5, 4, 3, 2, 1. Inhale again. 1, 2, 3, 4, 5. And exhale. 5, 4, 3, 2, 1. Last time. Inhale. 1, 2, 3, 4, 5. Exhale. 5, 4, 3, 2, 1. Let your breath come back to its natural rhythm. You may notice something shift, maybe not, but this is your moment for you. Always remember that you can come back to your breath whenever it is that you would like. It is FREE. Okay, Misha. We
I'm
got you
calm.
grounded and settled, girl.
I'm grounded.
All right. So now that we are all grounded, let's get into the meat and potatoes. So I want to set the stage for this conversation. A lot of us, including myself, have been raised to push through pain, right? And not complain, take a Motrin, keep it moving. And that's been the mindset that's been running with us. But what we don't talk about enough is how much that mindset can cost us. Because now that we're at an interesting point in our life where our bodies are changing, our needs are shifting, and at the same time, we're stepping into roles as advocates for our parents as they're aging. And most of us were never taught how to navigate either one of those transitions. So, Mayla, my first question for you, my darling.
Yes.
I've watched your journey since you were 18, which is crazy to say. But I want our listeners to hear from you. You went to Howard, you went to Emory, you went to UCSD. What drew you to anesthesiology? And then what drew you to pain specifically?
Yeah, so with anesthesia in high school, I just randomly I knew I wanted to be a doctor, and then I randomly was like, I'm going to be an anesthesiologist for no reason. I had no real idea of like exactly what they do or and I didn't know that much about the other specialties. It's just something that I thought about.
Mhm.
I saw it somewhere or whatever. And then I went into college, or actually it was during med school, and I started to you have to rotate across all the specialties. And I realized a few things about my personality that if I see a problem, not the person who likes to kind of keep chatting about the problem and rounding and doing this kind of stuff. So, like, internal medicine wasn't my thing because if I see labs that are off or your blood pressure is too high or too low, I just want to fix it and I want to move on to the next problem. So, with anesthesia, it's a lot of, I mean, everything is in real time. So if you see an issue, you fix it in the OR and then you kind of move on. So that was one thing. I like to use my hands and work with my hands. So with anesthesia, there's a lot of different types of procedures you do, whether you're putting lines in like IVs, central lines, you're intubating, you're putting breathing tubes in people, you're using different scopes. So I love using my hands. And so that was another thing. So once I decided anesthesia, then I learned that within anesthesia, there were different subspecialties within anesthesia, essentially. And that was really also what made me almost sure that I wanted to do anesthesia because I was like, okay, if I do this residency, I can still work in an ICU if I want to,
Mhm.
or I can be 100% OR anesthesia, meaning I just put people to sleep. Or I can do something that's completely outpatient, which is in a clinic like chronic pain. So once I learned about pain, I was very drawn to pain because of the way essentially it's our body's interpretation a lot of times
Mm.
with certain chronic pain conditions. So
Mhm.
it's essentially how your brain interprets pain and the way pain medicine is practiced today is very different than how it was practiced, what, 40, 50 years ago, where when you think about a pain doctor, you think about what you get some Percocet or morphine, and that's about it, or a simple injection. But now it's essentially, it's grown so much where we can essentially change how your body perceives that pain. I didn't take the pain
Mm.
away. It's just that now your brain can't perceive that pain signal. So I was like, "Whoa,
Interesting.
that is very cool." So then that's kinda how I got drawn to pain medicine.
Hmm.
That's so interesting.
That is interesting.
I can't wait to dive more into this. All right. So you specifically focus on bringing advanced interventional procedures to patients at Grady who have never had access to them before. Why does it matter so deeply to you? And what do you wish more people in underserved communities knew about what's available to them?
Yeah, what so why it matters so deeply is, I mean, I just see that, depending on your healthcare access, it can really
Mhm.
determine what kind of sometimes what all you have access to, really, and what you're aware of.
Mhm.
Grady does a lot. Grady's the county hospital. So it's the safety net hospital of Atlanta. It's where if you don't have insurance or you're in a terrible accident, you want to go to Grady. You're going to get well taken care of. And it's set up where it can take care of patients who don't have the ability to pay for their services. But I
Mhm.
think there's certain things like the way we treat pain has been stagnant a little bit because there's so many interventions that are out there that just haven't been offered at Grady, and I'm sure a lot of county hospitals. But yeah, so essentially, it was important because those patients deserve it like any other patient. Why not? If we have these kind of really cool interventions where you don't have to rely as much on medications that you don't want to take long term that could have side effects. Why not? Why don't you deserve it? You deserve as much as everybody else. So that
Yeah.
was kind of like I was like, and especially coming from private practice where I was doing it all the time, coming from San Diego where the clientele there, they were offered all sorts of these types of procedures. And so coming to Grady, I was like, this will be a full circle moment for me. In medical school, I took care of these patients and learned so much from them.
Mhm.
Residency, I learned so much from them and took care of them. And now I get to kind of um, help provide them more access because they've taught me
Yeah.
so much.
Yeah.
Yeah.
That just shows your heart. I love you so much.
That's gorgeous.
And I know I would ask the follow-up question of what those interventions look like, but we're gonna ask that down the lines.
Yes. So, for people who have never heard of interventional pain management, what does that actually mean versus how we understand pain management to be?
Interventional pain management just focuses on different types of interventions, so like procedures. So maybe less reliant or on just medications to treat pain because our meds are good, but they're not perfect or great, to be honest. And they're limited depending on your kidney function and this and your age and all these sorts of things. So interventions like simple injections like an epidural where you're putting a little bit of steroid into the epidural space for maybe somebody who has a pinched nerve, what people call sciatica, like that pain down their leg. A lot of people have that.
Mhm.
Chronic back pain, there's different interventions, injections for chronic back pain. You get arthritis in your back, and that can cause that kind of pain. And we have interventions where we go with a special needle that heats up and actually burns those nerves that send those pain signals. And it takes a while for those nerves to grow back and cause pain again. So for 6 months to a year, a patient can get relief and not have to take Tylenol or ibuprofen every single day or worse, oxycodone or whatever else they're on.
Mhm.
And then, interventions get to as much as something like spinal cord stimulation, where you're actually implanting electrodes in people's spines and it's sending signals to their spinal cord and interrupting the pain signal
Mm.
that's going to their brains. So now their brain, you're sending a signal faster than their pain signal. So now their brain only interprets your signal and can't feel their pain. So there's
Hmm.
all sorts of things that we can do now.
And so, versus that, pain management looks like giving medication, like managing the pain through medication
Historically, that's I think what
historically.
people and that was accurate, yeah, historically. That's what caused not just from pain management, but the opioid epidemic,
Yes.
because we were just giving way too much opioids, and then we realized they're bad and people are dying.
And by the way, that was happening for a long period of time. I like to, when I go to sleep, I like to listen to like royal stories. And it was very normal to prescribe laudanum, something like that, like
Vortex?
laudanum. Yeah,
Well,
which is basically a opioid. But they were just like, what I'm realizing, it took way too long for doctors to understand that opioids is addictive and extremely hard. It makes it worse long term, basically. It started in like the 1700s though. And I don't feel like we really realized it was bad until when did we figure out it was bad? I don't know.
I mean, we've known for a while that it was bad. The problem was also, I don't know if you guys watched any of the documentaries of the pharmaceutical companies and their
Yeah.
influence.
Yeah.
It was kind of a money thing too. So
Mm.
it's like, it's bad, you're seeing the bad outcomes, but these pharmaceutical companies, just like like the tobacco industry or
Yeah.
guns, like they just have so much power.
They don't care. It's so sad.
Mhm.
But I'm so okay. We got other options though. That's good to know.
Yeah.
Yes, this is very great to know. So some of us, self, Misha included, are in our 30s. Some of us are in our 40s. And our bodies are talking to us in ways that they didn't before. Like my knees are hurting a little bit more nowadays, okay? I got a little bit of back pain. Yeah,
Those are
it's really boob back pain, honestly. But what is actually happening in the body during this season of our life of aging, right? And what makes us more susceptible to chronic pain? And is some of that what we're feeling normal, or is it a signal that we should be paying closer attention to?
Yeah, All really good questions. 30s and 40s, it's an interesting time because there's a lot of things coming together. So there's the natural wear and tear, right? We've had our bodies now for 30 to 40 years. So your knees have been taking load for 30 to 40 years, your back, your neck, all of those things. So there's natural wear and tear.
Mm,
Degree of the wear and tear that you see in the 30s and 40s, it's so many different factors. What you do for work, what
mhm.
position you're in, your genetics. Some people just get arthritis much faster than others, unfortunately, and it runs in their family. Their mothers had it, and then, their moms got knee replacements at X age. And some of those things, obviously, your genetics you can't change. And then, interestingly enough, you in your 30s and 40s, there's so many different stressors. It's a peak time, actually. So if you think about it,
Mm,
occupational stressors, your job, your career is you're either, figuring out your career or it's a big time of maybe growth in your career. It's just very demanding. If you have a
mhm.
family, that's a stressor, like kids, young kids, things like that. And then financial pressures, all of these things, all these
Yeah,
stressors.
Yeah.
because you feel stress in your body, right? Like the stress, like you can feel stress in your shoulders and your neck, the tension there. I'm sure if you're continually feeling tense, something's gonna happen there.
100%
Yeah.
stress is actually one of the, like, it contributes, it leads to chronic pain. Yeah.
Yeah.
Damn.
I was going to have a follow-up question of saying, like, how does stress play into pain?
Yeah, so stress, your cortisol levels. If you're stressed, your cortisol levels are naturally they're higher, and cortisol can cause inflammation in your body over time. And that inflammation is really bad for pain. It starts changing. It can actually change how your body perceives pain. So, for example, something like that, there are patients where you can lightly touch an area and that's actually painful. They're not making it up. It's because their body has become hypersensitive.
Mm,
And it's in their brain. Their brain interprets pain completely differently than somebody without that, without chronic pain. So stress, the inflammation, the cortisol levels, and it's one of the most, you know, if you can, it's one of the things you can modify and actually change. It's easier said than done. Sometimes it's multiple things you have to modify, but it is an indicator to developing chronic pain. So stress is huge on like a cellular level and so much more.
so
Hmm.
the biggest thing that we can do, or the best thing that we can do to prevent pain in our 30s and 40s is try to alleviate stress in any way we can. Like if it's meditating, yoga, breath work, like doing proactive work to alleviate the potential of stress. It sounds like it's the best way to
There's
not to fall into this.
there's
Yeah.
three main things: stress, sleep,
Mm,
restorative sleep, not just laying down for 8 hours, but actually waking up refreshed. And that
mm,
might mean your sleep hygiene. That might mean a lot of things, but actually getting good night's rest. And then your physical activity and weight. So if you are inactive and you're very obese, you're more likely to have chronic pain. So
mm.
those are three things you can modify in your 30s and 40s and try to prevent yourself from developing chronic pain because it's easier to prevent chronic pain than it is to treat it.
Mm. So,
Yeah.
what are the different types of chronic pain? Like, are they divided into a certain type of category? Yeah, walk us through that.
Yeah, so pain in general, you can think of like the mechanisms of pain. So nociceptive pain is pain from damage or potential damage to like tissues or the surrounding area. So you can think of that as like knee arthritis, like osteoarthritis, musculoskeletal injuries. So like if you have an ankle sprain or a strain, or you tear a ligament somewhere, those are all nociceptive under nociceptive pain. Then there's neuropathic pain, which is nerve pain. So that's from damage to the nerves. That can be something like neuropathy, whether that's from diabetes. So if your blood sugars are really high over a period of time, it ends up damaging those nerves, and then you get numbness, tingling. Yeah,
Is that what happens to the foot? Like,
exactly,
mm,
exactly. So that's why diabetics, if your blood sugars are not controlled, those nerve endings, especially like in the feet, you get damage and then you get this chronic numbness, tingling, burning sensation. And then sometimes
mm.
it can get so bad that they can't feel. So if they step on a
Yeah.
nail and they don't know it's there, that can get infected and then they don't have good wound healing. And it can be, I mean, it can be a whole set of problems with neurology.
Wow.
Wow.
This is a tough conversation for someone who's very empathetic, like, because you're feeling each thing, and I'm like,
Yeah.
Literally, I had my foot underneath my thigh, and then when she said that, I was like, "Okay, let me move my foot because, oh." But not in the fact that, but it's like I can feel that, you know?
yeah. And is this the same for kind of gout? Because I feel like people with gout, they have issues with their feet and legs too.
Gout is like when you have these you have a buildup of something called uric acid and it can essentially form crystals in the joints. So oftentimes gout can be in like the big toe or in the hands and that creates a type of it can create joint damage and arthritis. But then when you have an acute gout flare, it's just a bunch of inflammation and pain. So that's how gout works.
God,
This is so
okay.
interesting. I'm learning so much from
It
you.
is. It's also scary.
It's
It is.
there's
Scary.
so much we can do. We can't change our
Mhm.
genetics, but there's so much
Yeah.
we can do that we try
Yeah.
to modify this stuff.
It's just a reminder, just like our bodies are kind of vulnerable to anything. And that is scary because there is so much that we can control. We can't control everything. Like you said, we can't control our DNA and yeah, but we can't control how we eat.
Yes.
But that doesn't
Mhm.
always mean that yeah, I can go on and on about this. But okay.
No, I was just to Misha's point, it's also hard. It's not just controlling what you eat. It's like we're kind of at the US, it's so hard to eat healthy. Like it's so hard. It's
Hmm.
expensive to eat healthy. It's like
It
you're
is.
the burger or something is gonna cost you less than getting this, like, organic salad with quinoa and this and that, and then it's like you do get those things, and some of it's, like, super processed versus you go to these other countries, and it's like, "This is just what we have. We just have real cheese and real this and or everything's organic because we don't have we just don't put pesticides." So, I just feel like it's so hard to be healthy here.
It is. It is. You can also walk a lot in Europe. Here, I feel like the auto industry lobbied to create highways and lessen
Walkability.
like trains and stuff like that in America so that people would like they had to buy cars instead of London where there's the tube that you can ride and you can walk and there's a really good bus system. You only get that in like major cities. Like if you're in the south, you're driving. Walking is not really an option.
100%,
Yeah,
and that ties into that your activity level and how that's one of the contributing factors to chronic pain. So it's like it's harder to not have pain in the US, I feel like, honestly.
I'm glad we named this though. Like that's just something that we have to be aware of and recognize and yeah, work with.
I agree. I think it's also just being more intentional, right? Like, I know for me, I try to be more intentional about walking throughout the week or getting like
Mhm.
my 10K steps. Me and Melat, we work out on Mondays and Thursdays, but last Thursday we weren't able to. So I was like, "Are you busy on Friday? Let's do a neighborhood walk." And
Mhm.
so we just did a neighborhood walk, you know? So I think it's important to build community and be more intentional in that aspect of it.
Yep,
But
I agree.
to move us along, I think that some people are wrestling with maybe some distrust in the medical system and sometimes being pushed toward two extremes. So either refusing to go to the doctor at all or feeling like medication is the only answer being offered when they do. And I want to touch on you practicing what you describe as a multimodal holistic approach to pain. What does that look like in practice? And can you walk us through what it actually means to treat a patient as a whole person?
Yeah, so multimodal, holistic, it kind of ties into each other. So essentially, for example, when I have a patient with chronic back pain, all right?
Mhm.
Chronic back pain is one of the leading it costs the US healthcare system billions of dollars a year. It's like number 1 or number 2 reason to go to the emergency room. So it costs us a lot. So when they come to me, I try to get a sense of who they are. Are they someone
Mhm.
that's going to go to physical therapy? Because the first thing is physical therapy. You need to move and you need to move intentionally and you need to move in a way that's not going to make it worse. But there's this saying I think holds true in medicine. It's use it or lose it. If you don't use those muscles, you're going to lose those muscles. And then that's going to be your source of pain, right? So I try to gauge, like, is this patient, do they, especially at Grady, I have to think about the socioeconomic factors. Like, can you come to physical therapy? Is there going to be a copay? Can you get there? Is it going to be hard with your job? So I try to get to know the patient and what their life looks like, because it's easy to just be like, this is what you need to do. Okay, bye. Next patient. But
Yeah.
if you don't meet them where they are, they can't get those things done, and it's almost unfair, right? So first I'm like, okay, yeah, physical therapy. Is this someone who's going to be committed to it? Do they have access? Is cost going to be an issue? And if it is, then I include home exercises for them to do. Or if try to give a suggestion of go to one physical therapy session, just one, and tell your physical therapist, I can't go to every session. It costs too much, or I can't get there because of my job, or whatever the reason is. And say, give me a home exercise program and watch me do it once to make sure I go home and I'm not doing the exercises incorrectly and making things worse. So you go home and you're confident and you know, okay, these are a few exercises I can do and a professional has told me I'm doing it correctly. So that, and then so part of the kind of multimodal or holistic approach, I'm a big believer in turmeric. Turmeric is a great natural anti-inflammatory. The data is pretty good for turmeric, and the active component of turmeric is curcumin. So you got to make sure when you buy turmeric, it has curcumin. And also black pepper helps your body absorb the turmeric. So you want all three of those things to be on the bottle: turmeric, curcumin, and black pepper.
And do you utilize that like in your cooking, or how would you say that people should incorporate that into their diet?
Yeah, so I use it all the time in my cooking because I cook Ethiopian food and Indian food. But when you use it in your cooking, you have no idea how much you're getting. And I don't think I'm getting 1,000 milligrams. Around 1,000 milligrams is the number that I say that I think is semi-supported by data and is not going to cause harm. I think it's more positive than anything else. So I tell patients to buy it off of Amazon. There's one on Amazon specifically I love because it's $9.99 for a 3-month supply. And
Come on.
it has all three of those things, because sometimes you go to these health food stores and they add a bunch of stuff that has no data to support it, probably is not really helping you, and then it's $40 for a bottle. Patients aren't going to continue that, or they're going to feel like they have to stop at some point. So I like to include like some natural supplements as part of their plan, physical therapy. And then a lot of times with chronic pain, there's a psychosocial component. There's depression, anxiety, PTSD. These are all risk factors of developing chronic pain. So if you just treat just the pain and you don't really try to understand, I'm not a therapist, I'm not a psychiatrist, I can't prescribe you things for those conditions. But if I can at least acknowledge that this could be playing a role, then I can say, hey, you may benefit from like cognitive behavioral therapy or a pain psychologist. Some practices have access to those.
Wow, never heard of that.
Yeah.
Me either.
And it's huge. So some patients can really benefit from that and understand that they need to change their relationship with pain from
Yeah.
a mental standpoint.
That is so interesting.
Yeah. Have you heard of, is it ENS? It's like a disease/disability where you kind of randomly feel pain or randomly feel or get injured, like you're susceptible to getting injured pretty easily. I'm reading a book by Lena Dunham who did Girls, and she has that, and she basically deals with chronic pain. And she kind of had this idea that it was going to get better, and she finally had to accept that, like, this is what I got. This can happen to me often, and it's a disability. Like, you have to change your mindset around some of these things, especially if you're gonna have to deal with it for the rest of your life, essentially.
100.
Interesting.
Yeah. Yeah.
A whole nother
That's
layer.
very interesting. But this is information that I can take to my aunt who is dealing with pain, and I'm pretty sure there's some mental woes that are going along with that as well. So now I want to dive into something that I know can be personal for a lot of people. I know it's true for people in my own family. So you go to the doctor in pain, they recommend surgery, you do the surgery, you recover, and then the pain is still there. Or it's a different type of pain. and you can completely feel lost, you feel betrayed, you feel all other feelings. And through research, I learned that there's something actually called failed back surgery syndrome or post surgical pain. And studies show it affects up to 40% of people who have had back procedures and about 20% of people who have had knee replacement. So, why does surgery sometimes not resolve the pain?
That is a loaded question.
Ooh, take your time. Parse it out.
It's a lot because it depends what type of surgery we're talking about. So, for example, like spine surgery,
Mhm.
there's a lot of spine surgeons, really good ones out there that will tell patients, don't get the surgery for pain. Get the surgery if you're having weakness or changes in sensation, things like that. Surgery is great to fix that kind of stuff. Like if you have damage in your somewhere in your back and it's causing your right leg to be weak, where you're dragging your right leg, it's not as strong as the left. There is no injection that I can do that's going to help with that. You should get
Mhm.
surgery. But if you're like, well, you're really strong in that leg, but you have pain, it may get better from surgery. That fusion might help and relieve that pinched nerve and you may feel better. Or you may still have that pain and now you're fused. Your back is no longer as mobile as it used to be. And now you develop other type of pain because your spine
Yeah.
should be able to freely move. If you fuse one level, the level above and the level below that fusion now takes more load because it can move, but this can't
Mhm.
move. So now you develop arthritis faster at the level above and below, and now that causes
Mhm.
pain. So it's complicated, and it depends on why you have pain. We talked about those 3 different types of pains.
Mhm.
The surgery may fix that one type of pain, but there might be this other 2 components that the surgery won't fix, so you may still have pain.
What about when it comes to knee surgery? It feels like people, like elder people, just keep getting the knee surgery like over and over again. Can a knee ever be fixed? That's my question.
Yeah. When your knee is like bone on bone arthritis, knee surgery is great. Like for most people. Sometimes one of the reasons people don't do well after a knee surgery is they don't do their PT.
Yeah,
They don't do their
that
PT.
sounds right.
They do surgery and they're like, I'm done. Now I'm like back on the couch. No, it's like, no, 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 no. You have to do PT. You have to follow what they say. You have to strengthen. You got to move.
Wow. There's responsibility that we have to take on, and it's not just the doctor who can fix out everything. We have to do our part too. At
Yeah.
what point do you say no more surgery? Let's just try something else, even if there is something else to try.
Yeah, that's that conversation usually the patient has with the surgeon. I mean, there are patients that will ask me my personal opinion, and then I tell them, if you were my mother or father given X, Y, and Z, this is what I would recommend for them. But ultimately, I'm not the surgeon. I don't have I don't have experience in surgery. I don't get to see the outcomes as much as your surgeon and things like that. So that conversation needs to happen with the surgeon. But again, if it's true just pain, I'm like, hey, let's try a few other things before you go down the surgical route because there are people their pain does go away after spine surgery, but there are a lot that don't. Like Taylor mentioned, failed back syndrome. Those patients, one of the main things we can offer them is a spinal cord stimulator. We literally just try to
Mhm.
block that pain signal because there's not surgically you opened up the space that was too tight, but you still have pain. So now I'm just going to tell your brain that you're going to pay attention to this signal and not the pain signal.
Hmm. You are a wealth of knowledge, girl. That education you retained, girl. I mean, obviously, as a doctor, you have to retain all of this, but I'm very impressed of like how this, like, it's just natural to you.
Thank you.
Yes.
She loves it. She loves it. So we're at the stage in life where we are watching our parents age, and in a lot of cases, becoming the bridge between them and the medical system that can feel a little bit overwhelming and can feel maybe dismissive at times. So, my question to you is what do you wish more adult children knew when they were taking a parent to a pain related appointment? What are some questions that they need to be asking that most people aren't thinking to ask?
I think in general, not just pain, but when you go and you see a provider, if there's anything invasive, like whether that's surgery or any type of procedure, number one, if you're actually trying to help your parents as much as you can and you're able to research, you got to do your own due diligence at the end of the day. The physician will tell you all the data and things like that, but it's also important to read and ask the appropriate questions. And then if you ever feel like, you know, I don't know if I want neck surgery or cervical spine surgery. It's a big thing to do, right? Put hardware in my
Hmm.
neck. Get a second opinion. Get a
Yeah.
second see another surgeon. And it never hurts, especially because this is something permanent. So just do your own due diligence, research and learn as much as you can. Some things you may not understand, but that's what the physician's there for. But come with your questions. And then you're always entitled to a second opinion. And and any good doctor shouldn't feel offended. A surgeon shouldn't feel offended if got a second opinion just because that's your mom and yeah, you don't know if spine surgery is the best answer right now.
Yeah,
I
that
think
makes
that
sense.
answers our last question too. So I think we just wrapped up our meat and potato section.
Whoop,
And
whoop.
Taylor is going to lead us in the rapid fire, which is kind of like my favorite thing to do with the guests. We didn't do that for Raven,
We didn't.
but she gave us so much juiciness. It's okay.
All right, Melat. So rapid fire questions. First thing that comes to mind, okay?
Okay.
Can't think on it too hard.
Okay.
You ready?
Yeah.
Okay. One thing you wish everyone knew about their body that most people don't.
That if depending on like what's going on with your body, like okay, like back pain, the old actually okay, I'll go back on that one. Stress. The impact of stress. I think people understand. I think mental health is like so well talked about now and more addressed, but I don't think people understand like the chemical changes that's happening inside your body and how that's important too.
That's a good one. What is the most underrated pain remedy that actually works?
I think turmeric. Turmeric, I love turmeric. My parents take it. I take it. I don't have pain. I just take it. But uh,
Wow.
I
I'm taking now too.
I think it's great. And then one other one, if you have nerve issues, like my dad has a pinched nerve down his leg and he takes alpha lipoic acid. It's a supplement. And it kind of works like, a lot of people have heard of like gabapentin and things like that for nerve pain. If your parents have it or anyone you know has it, that's a common first line medication. But alpha lipoic acid is a natural like gabapentin. And it doesn't have gabapentin can make you gain weight, can cause leg swelling, can cause all sorts of things. And some people tolerate it just fine, but just the natural stuff. So the turmeric for inflammation, the alpha lipoic acid for nerve pain, I think.
Does that also work for people who have sciatica?
Yes. Yeah. So my dad has sciatica and
Okay, good to know.
he takes turmeric and alpha lipoic acid. And after a month, his pain went away. I thought I was going to have to do an epidural, but his pain went away. Yeah.
Wow. Okay, so I'll tell my mom. Something a doctor told you growing up that you now know wasn't right.
That's interesting.
Hmm. That I know is not right. I don't think personally I have anything, but just in general, I think back in the day, there was a whole kind of idea of like rest the area. Like if you have back pain, you just need to lay down. And it's
Hmm.
like the data is showing you need to get up. You don't need to lay down. You lay down, the pain gets worse. So unless you have like an acute fracture or something, like then maybe don't get up so fast and do those things. But for the most part, you need to move.
Okay, good to know.
That's good.
So get your ass up. Last question. What
Respectfully.
You're respectfully. I didn't say that.
respectfully, sorry. It's coming from me. Last question. What do you do personally when your body is asking for rest?
Um,
I know what you do.
yeah, I know. Yeah, I just hang out in my shower for 40 minutes and watch TV. Yeah, honestly, yeah, I watch TV. I just veg. Like, I just watch TV and then just a good night's sleep does wonders for me, like getting enough sleep and a nap. Sometimes I just need a nap and I don't take those that often, but sometimes a good nap and I feel good.
Sometimes a
Mhm.
girl just needs a nap. It's so real. It's so real.
I love me a good nap.
just like quick side, I now with my ADHD medication, I really can't take naps anymore, and that's hard. Like I can't sleep until it's 10,
It
11,
wears off.
basically.
How's your
Yeah.
nighttime sleep? Is that still okay?
Sometimes I'm gonna have to figure something out. I think I'm gonna take my medication earlier so I can start going to sleep a little earlier, or at least have like a little bit more cushion. But
Mhm.
currently I need to figure that out because I love sleep. Sleep is so important to me.
Yeah.
Mhm.
Yeah. Definitely move that. Yeah, take it earlier if it's, if it makes you feel a little jittery or too awake when you should be
Yeah.
winding down for sure.
Thank you so
Good
much.
things
This was
to
such a
know.
good time.
Thank you guys for having me. This was fun.
Oh, I'm so happy. I'm so happy. I'm so grateful. Thank you for your time. Thank you for your knowledge, your wisdom, your heart. Thank you just for being you and my built in sister. Please tell our dreamers where to find you and how to connect with you.
I don't know. Where to find me? I don't know.
Visit me at the hospital.
Yeah, I mean, I hope not. I hope you don't have chronic pain. Go, like, go sleep. Don't be stressed. Work out and don't see me is hopefully like the best advice I can give you. But, yeah, no, I mean, yeah, you probably can't find me. And I mean, if you
Don't find her.
She's not active on socials like this. Honestly, I don't even know why I asked the
Yeah, I'm
question.
not active on social, but if you have a parent or somebody that needs, their pain addressed and you want to bring them to Grady Pain Clinic, I am happy to see your family members or you. And then I do have to say everything that we talked about is not like me giving medical advice. It's just my opinion.
Thank you for saying that for us. We do not want to
Yes.
get.
Yeah, well, we're not getting person.
Do your own research, everyone.
We're like, I
Do
took
your own
turmeric
research. She
and
said reading is fundamental, y'all.
you said what?
I said, you basically said reading is fundamental.
Yes. I just don't want anybody to be like, I took turmeric and now I have this, and you did. Dr. Gebre told me to take that. It's like, nope, that was my opinion. That's it.
He loves turmeric,
I love
okay?
turmeric.
She does love turmeric. All right, y'all. Melat, thank you so much. I love you so much.
I love
I'll
you.
see you in like an
Till
hour.
next time.
Well, thank you guys so much for having me, and I'm really proud of both of you guys. I think this podcast is very special, and I think you guys are helping a lot of people. So.
Thank you so much. We appreciate
Don't
that.
make a
And
pimp cry, girl.
thank you for all that you do and the hard work you have done to get here. So much
And when I tell
respect.
you
And
hard work,
Thank you, Misha.
homegirl has
yeah.
worked her AWS off. Okay?
And you
I
just took a
need y'all to
vacation though
know,
too,
like,
which
she
is
is the
good.
true, I kid you not, like, through college. So I just got to give you your flowers right here. But through college, homegirl knew what it was like to work hard, but also play hard. Like, the duality of it all.
So this is
She's
after
the
dinner.
perfect example. I'm not going to dive into the duality of the play hard part, okay? I'm just talking about the hard work part. She is the true testament of what discipline really looks like, which is why I say that she's my role model. I've looked up to her since I met her. So,
What a blessing to have someone in your life so close that you get to model, like you can see as a model for you.
yeah.
But the play hard, because you just went to Italy, right?
Yeah, I just went to Italy. Yes.
So she's a hardworking mama and wife, but she gonna take her little trips, and we love to see
You
it.
have to. Life's about balance, right? You guys talk about it a lot. I feel like about you got to pour into yourself if you're going to help other people, for sure.
Thank you for being an
Oh,
example.
wow. Look at that.
I remember some things.
You remember some things. Okay.
Have a great day. We thank you for your time.
All right, I'll talk to you guys later.
Okay.
Care.
Bye. Love you.
Love you too.
All right, y'all. So that was my sister, Dr. Melat Gebre. I just love her so much. And I'm so glad that y'all finally got to meet.
I understand why you love her. I love her too, I think now.
Listen, y'all can talk about housewives when you are done with your Bravo binge. I mean, not
I
Bravo
will,
binge,
because
but
I need more
Bravo
people.
what is it? Hiatus.
Yeah, I'm taking a little fast. Yeah, I will, because I need more Black people to talk about Bravo with. Again, anyone here who's watching, if you watch Bravo, I want to talk about it with you. Okay. But
Talk
now it's
about it
time
with
for
me.
our Be Well RX.
Come on, your dose of upliftment to carry with you throughout the week. So, as you may know, we got some affirmations for you. So, The first one is, my body is not my enemy. It is communicating with me, and I am learning to listen. Listen to your body, okay? Second one is, I am worthy of care that sees all of me, not just my symptoms. And the last one is, I can advocate for myself and for the people I love. My voice matters.
Yes, it
Say them
does.
out loud, write them down, and let them take root.
Amen. Amen. And the journal prompt for this week is, where in my body have I been ignoring something that deserves my attention? And what would it look like or feel like to approach this with curiosity instead of fear? I think part of this question, you really actually have to ask yourself and feel into your body and just kind of like, all right, where do I feel fear? I mean, pain that I haven't been acknowledging, and then explore what it looks like to approach it with curiosity instead of fear. So, yeah, sit with
Absolutely.
it. You don't have to have all the questions, but just ask the questions at least. Okay. In closing, if this episode spoke to you, and I believe that like a lot of us will get a lot out of it, even if it was a little hard to hear at times. If you're empathetic like me and can kind of imagine pain that others are feeling, but we
Same
would
over
love for you to
here.
share it. Yeah. Please share this with someone in your life who has been pushing through pain quietly, or a friend who is becoming a caregiver and doesn't know how to start, or a sibling in the group chat. Share this podcast and help this conversation travel and enlighten more people.
Period. Also subscribe so that you don't miss what's coming next. Okay. And then you can also find us. Come find us because we want to hear from you. Okay. We want to hear from you. What landed? Do you need to make that doctor's appointment? I think that you probably do. But anything else you have opinions on, drop them in the comments. Follow us on Instagram and TikTok at Muse and Be Well.
This has been Muse and Be Well, where we remind you to trust yourself, stay grounded, and be well.
See y'all next time.
Bye. Awesome. We did it.